responsibilities that social workers have in their work with clients across the various healthcare settings. First, when we talk about medical social workers, again, medical social workers are found in a variety of settings, and these can be directly in hospitals, in different levels of hospital settings. They can be in home health, they can be in hospice. Some primary care physicians employ social workers who are in their offices. Medical social workers can actually work in long-term care. So medical social workers, when I refer to that, I'm referring to across the gamut of the healthcare system. And the social workers directly address social, behavioral, and emotional concerns of individuals for their health situation and the social support networks, as well as we develop and we administer policies and programs. Again, we conduct research and we stay attuned to the psychosocial needs of the individuals. So in terms of a medical social worker, I think this is one of the most holistic roles that a social worker would engage in, because we literally work with every level, micro, meso, macro. We work with families, we work with paraprofessionals, we're on interdisciplinary teams, and we really have to be able to have good skills in mental health, and we have to have a good understanding of physical health aspects, medications on both sides of that, and the social systems that really impact the outcomes for the individuals with the healthcare situation, as well as their families and those support staff, and then how this works financially. So for me, in the gamut of social work, I feel like that a medical social worker is the one that has to develop the highest level of skills around all of these areas. Now, we're not going to be experts in mental health, and we're not going to be diagnosing mental health, and we're not going to be diagnosing physical health, but we're the one profession in the healthcare realm that really ties everything together. So it's like we're the cog in the wheel of this healthcare system for those patients and their families. So really, we do help the clients, they're often referred to as patients in the healthcare system, to problem solve and cope with stressors related to physical injury, physical illnesses, chronic illnesses, acute illnesses. We link those individuals and their families with the various resources, services, opportunities that are out there. So we have to have a good understanding of who qualifies for what, and have that strong networking so that we can get individuals linked up, because we want to promote optimum health. So even if somebody's living with a chronic illness, we want them to live to the highest level possible. And in doing that, we have to address all of these issues. There is newer research that has been coming out over the last 5 years or so, that looks at individuals who may have had an acute healthcare crisis. Something happened, but they healed and they moved on, but they may have some PTSD associated with it, because it was a traumatic event. So our health can actually impact us at every point in turn. And again, that's why as social workers, we need to at least have some understanding of health and how that impacts the mental and psychosocial outcomes for the individuals we're working with. And the other area that we don't delve into too much, but it will be in the last module for this course, is really health and wellness. And I feel strongly, and I'm a huge advocate, that social workers really need to promote healthy living, healthy lifestyles. And yes, that does have to start with us, in terms of getting the amount of sleep we need, following the diet we need to follow, managing our mental health. And when we have those skills down for ourselves, then we can certainly help our clients learn those things, and then we can all live better. So I really promote the fact that social workers need to get more active in the health and wellness. We tend to be very reactive, even though we talk about coming from a strengths perspective in our programs, in our professional NASW and the CSWE and all of the educational realm, but yet we're still very reactive. We wait until a situation happens to address it. And we know from a health perspective that we can actually alleviate a lot of suffering if we do it in a proactive way. But we'll talk about more of that towards at the end. But I think that's a strong role and responsibility for social workers with clients across all settings, but specifically when we're focused into the healthcare setting. So just like other settings, the activities that we engage in those direct care settings include a careful assessment of patient situations, which means the patient themselves, as well as their social support systems, their educational access to resources and all of that. And then we also design and implement various interventions, whether it be from a perspective of discharge planning, whether it be from a trauma-focused perspective to help individuals live with acute, severe illness, injury, whatever that might be. Again, so we do careful assessments, and then we do provide interventions, and then ideally we provide some form of evaluation and follow-up to determine if the interventions were successful. And while we always do an original assessment in a healthcare setting, we always look for strengths and needs of individuals and members of their social support system, no matter what setting we're in, but the assessments may look a little differently. I know hospital social workers typically will have a standardized assessment tool that they use, and sometimes it's a checklist, and it doesn't get very well in depth, but it's up to the social worker to maybe probe a little deeper beyond that checklist to determine what the needs of that patient might be. And I say that because I have a lot of experience in this area. And in the 1990s, when there was restructuring and re-engineering of hospital settings, and this is when many social work departments went away and came under the auspices of the case management departments in the hospital. Case management departments typically are headed by nurses, licensed nurses. So all of a sudden, social workers were placed up under nurses. And I know at our hospital, I was on some of the teams that were doing this, and there was a great deal of push because the nurses were telling us we did not need to do an assessment. We only needed to use their information. And I'll talk about this a little bit more in this presentation here, but that goes against our license. Our license states that we have to do an assessment before we do any type of intervention, and that assessment needs to be a first person, if you will, assessment. It's not using collateral information. We use collateral information to actually inform some of our assessments, but our license, if you're a licensed social worker, the licensure law states that you have to do your own assessment. You cannot rely on somebody else's. So that was a big pushback in the hospital, and I'll talk about more of that in later in this presentation, but it is an area that we really have to watch for. If you're into oncology social workers may have another standardized instrument that they use specifically for cancer patients to assess their needs, and the same thing like if you're in acute rehabilitation. So your assessment may look a little bit different if you're on a specialized unit versus if you're in just a general acute care setting. This particular slide addresses what I was referring to previously, and we do use a lot of collateral information. You can gain a whole lot of good information by looking at your nursing assessments, your physician notes, the patient's physical history, reviewing those medical records and getting that information. Those are great sources of information when you're conducting assessment. However, we have to have a direct assessment with the patient and or the family. Ideally with both, if the patient agrees to allowing the family to be a part of that, to obtain that primary information and verify collateral information is correct, then we actually have to gather our own information. And I can't tell you how many times, it's just too many to count, that when I was doing an actual one-on-one assessment, I determined that there was a great deal of misinformation in the collateral information that was being gathered. there's a variety of reasons for that. If you're assessing a patient at different points in time, they may have unclear memory of things. They may be overwhelmed or confused, or they may not understand the question. But it happened repeatedly that once I looked through a medical record and then assessed a patient, I found that there was discrepancies there. And then I would go back to the original source who did that assessment. We could have a discussion and we can determine where those discrepancies are at and come back to the patient and clarify that. Accurate information is so vital, especially when you're in a hospital setting, so that when that patient leaves, they have everything they need to be successful outside of the hospital setting. And if you don't have a clear assessment of that, you could potentially miss something. Another role and responsibility that a social worker in a healthcare setting may have is to help explain the disease, its treatments, its processes in a manner so the patient and their family can understand. And we are not giving medical advice. We are not, providing that medical information. But sometimes it's really important to stand in the room when the doctor or another medical professional is explaining something to the patient and to the family, and then to take that opportunity, or after the medical professional has left, to take an opportunity to say, do you understand what they're telling you? There's this little cartoon that I absolutely love, and it's a picture of a little elderly person, and they're in the doctor's room. The doctor's in there, and the statement is that you actually only hear half of everything when you're naked. So, we don't think about oftentimes that patients are not hearing what they need to hear and understanding what they need to understand. And what's more intimidating than a doctor or some other medical professional coming at you from this expertise, telling you what's going on, telling you what needs to happen, telling you what happened, and then you saying, well, wait a minute, I don't understand. So many times that does not happen. So one of the key roles for a social worker is to facilitate that communication between the providers and the patients, because understanding is so important. And if you really spend some time and you're able to get into talking with your patients and their families, it will become much more apparent how little they do understand. When we're in the healthcare setting and we're working in those healthcare environments, they tend to be very fast-paced. Things tend to become very secondary to us. It's just something natural that happens there, but we have to stop and think every single time we encounter that patient, it is their first time to be in that setting. So we have to take it from that perspective. So again, I think this is a vital, vital role that social workers should play in the various healthcare settings, is to be that liaison between those medical professionals and that patient and that family, to make sure the communication is happening. Because communication breakdown is number one reason that patients will end up back in the hospital. They didn't take their medication correctly. They didn't understand the wound care. They didn't get the sort of resources they need, whatever it was. So this is a key area too that social workers should be very adept at coordinating and managing. As a social worker in a healthcare setting, you can become a key personnel. Sometimes we have to do things to develop our power within these settings. We are a minority profession, meaning that there may be only a handful of social workers when compared to the number of physicians, physician assistants, nurses, physical therapists, occupational therapists. So we tend to be what would be a minority profession, and as a minority profession in these settings, we have to actually establish ourselves as having some power. And one of the powers that we do have, so that we can use it to make a difference in the life of the patients, is our knowledge and our networking skills that are necessary to, number one, assess those needs, and then to identify, secure, coordinate, and connect into those community-based services. This becomes human capital that is vital for social workers to be successful in healthcare settings. So the case management component of what we do in healthcare settings is, again, vital to what we do, and it really lends the power that we need to be able to earn the respect of those medical professionals. And what I mean by that is oftentimes the social worker can just be looked at as a do-gooder, as a quote unquote discharge planner. Discharge planning, from the perspective of a definition of arranging home health, of arranging medical equipment, of just the basics, that doesn't require a professional level licensed person to do that, okay? But it does fall under the realm of what we often do in an acute care hospital setting. But discharge planning should be so much more, and it should be a comprehensive, holistic perspective, bringing everything together. When you develop those skills and you invest that time, then you become an expert in the hospital setting, and you have the ability to being on different interdisciplinary teams. And that's how we can truly start impacting the system so that it'll be more responsive to the patients. Again, we're that link between the patient and the community, but we're also that link between the patient and the family and the healthcare system. And then, of course, we have our clinical skills. And even if you're not an LCSW, even if you're not trained to that high level of clinical skills, because our educational and experience levels teach us about the mental health and some interventions, whether it be a crisis intervention, whether it be a short-term intervention, we have skills that can help families and patients cope with the illness and the treatment recommendations from the mental health perspective. So again, you don't have to be LCSW, you don't have to necessarily be providing one-on-one therapy, but we come with this holistic package, especially from our program, which is an advanced generalist program, so you're able to touch on all the different levels of skills and get knowledge in those areas. So that's what we bring to these patients and families and help them understand and cope with what's going on physically, and then connecting them with future resources to help that. Because no matter what's happened to you physically, it's going to have a mental health impact for sure. And also, too, in various settings, specialized settings, again, dialysis, transplant, physical rehab, oncology, some pediatric specialty areas. Health social workers will often run support groups for families, and this again brings our expertise into the health realm to help with that mental health psychosocial support aspect of it. So this is something that happens, and social workers have a little bit of leverage of being able to provide this outside of the realm of their normal job description and provide that support for patients and families. If you're willing to invest a little extra time and effort into it, you can potentially develop these things. So health social workers oftentimes are running these support groups. They identify the need and they put together the support group. I know when I worked in rehabilitation, we put together support groups for amputees, individuals who had an amputated limb, and we held it once a month. And so there's opportunities for social workers to really get into areas that they're very interested in, into healthcare. We have to push back a little bit and we have to expand what we're doing. But once in that healthcare setting, the administrative individuals see that what we can do is provide such benefit to the patients and clients. Again, it takes a little while to develop that relationship, but once it happens, there's a lot of opportunities that we have and that we can create to benefit the patients. When we're in a healthcare setting and we find ourselves in clinical, administrative, research roles, then again, we're instrumental in helping those healthcare teams and incorporating community members into the higher level systems perspective so that we can increase the positive outcomes for the patients and the families. And we can begin to balance the needs of the system, the healthcare system, with the needs of the patients and the families. If we're into that, it's complicated, it's a lot of work, it can be a lot of frustrating, but the outcomes can be so beneficial, and they can be long-term outcomes, again, when we're planning the services that meet the needs of those who are coming to our community hospital or healthcare settings. And as I've indicated before, we're actually mediators between the healthcare system and the consumers of that healthcare systems. So we are involved in advocating at the systems level in healthcare when we work in healthcare. We should be, let me put it that way. So we can be on a healthcare team, we can be in an administrative role, and then we can actually work to be that mediator and bring that patient family perspective into the healthcare system and the healthcare team and make true differences there. I can tell y'all, just talking about this, I'm so missing working directly in healthcare. It's just where I belong. And I think that we can make such a difference down the road for patients and families and clients if we were to actually elevate ourselves in many areas beyond just going and being what they determine is a discharge planner. That's kind of a rub for me there. And I can explain a history about that. But even if you're hired and your primary role is discharge planning, you have to know that it is so much more than just setting up the home health and the equipment. It is a holistic perspective for it to result in a positive outcome for that client or that patient. The other aspect of being in healthcare as a social worker is you really interact with a variety of other professionals. And this can be physicians, the therapists, dietitians, nurses. Sometimes you're interacting with lawyers, you're interacting with insurance companies. So you really are interacting with a whole lot of different individuals in creating these links, in explaining these links, and being that mediator, that middle person. So what I will tell you in healthcare, and I haven't totally worked in a lot of other settings, but in healthcare, I can tell you that one day never looks like the day before. It can be so different, and it is never mundane. It's very fast-paced. And again, you have to really develop skills. Communication skills are important. Negotiation skills are important. Critical thinking skills are important because you're basically there and you're that cog in that wheel and you're having to think on your feet constantly. You don't have a recipe to follow all the time in terms of what you're going to do for this patient or that patient. You really have to think creatively. Health social workers may serve as supervisors in their practice settings by providing that clinical supervision. And there's a lot of settings, again, transplant settings I know for sure require LCSW. There's some other settings that will require LCSW. And so there can be opportunities for social workers with the LCSW. I know Veterans Administration provides opportunities for social workers to get their LCSW. So in some of those highly specialized areas, that can also be a role for a social worker, and again, providing that clinical supervision. They may be in some form of an administrative role for the agency or the organization. And so they're acting as supervisors. And when we act as supervisors, we actually have to act within the role that the organization sets down for us. And then we also have to be attuned to our code of ethics and our professional standards and providing supervision within that social work setting. We don't divorce ourselves from our license and our profession if all of a sudden we're the director of case management. We incorporate those two, so we have to be able to balance both of them, the expectations of the organization along with our commitment to our professional code of ethics and our professional licensure laws and how all of that works together. And again, assessment of the need is always the first step. So no matter when we're going to encounter that patient, we always begin with an assessment. And in some settings, social workers will see all the patients in a clinical setting in which they work. So like if it's a transplant floor, an oncology floor, dialysis floor, every patient that's admitted to that level of care, that social worker may see and assess. If it's in an acute care setting and you're on a med-surg floor, you may only see and assess individuals who are age 60 and older who may be at high risk. There may be some criteria there. But assessment is the first step, and it's a psychosocial evaluation typically that should be happening that, again, looks at the whole gamut of issues and potential challenges as well as strengths of the patient and the family. We provide the case management. We could provide counseling. Again, we provide education. And all of this, along with some very instrumental tasks of connecting with community resources, can fall into the discharge planning. The idea is to get individuals out of a healthcare setting. None of us want to be in a healthcare setting forever. So the idea is to get an individual to a point where they can get out of a healthcare setting and they can function at their optimum level without being in a healthcare setting. And so that encompasses all these components. And again, assessment of the need is the first step in care. We always do our own assessment. And again, sometimes social workers only see the patients in healthcare that require their services. So this may be some form of screening or referral mechanism. So in an acute care hospital, it could be set up where in the morning at a census meeting, there is some screening criteria, and it identifies the patients with the attributes that click them into that criteria where you would need to see them, and you would not see everybody that's on that floor. Or there can be a referral mechanism. So maybe there's somebody that needs social work services, but they don't fall into that screening criteria. A physician, a nurse, a therapist, somebody else can write an order for a social work evaluation. So there can be needs-based care in assisting that client as opposed to just overall general seeing everybody that's on the floor. And again, some health social workers may be contracted through their private practices to provide specialized or therapeutic treatments. And this is going to go into those more specialized areas: oncology, pediatrics, rehabilitation, transplant. So there could be times when social workers have a private practice, but they may enter into a contract with a hospital setting or something to provide some therapeutic services for the patients. It could happen through physicians' offices. It could happen in outpatient settings. It could happen in home health settings. It can happen in hospice settings. But there's an opportunity for that to happen also, especially in some rural areas where there's more limited resources. That could actually be a role that a health social worker, even though they have a private practice, could be playing for patients in a healthcare system. Public health social workers, and oh my, haven't we had a focus on public health over the last year and a half. Public health social workers take a very large macro perspective. It's the public health perspective, and it's going to be much more of a political perspective, much more of a legislative policy type perspective in working with the public health social work programs. My understanding, and this, I haven't delved into the actual evidence of this, but my understanding is public health individuals are bailing out of those roles as quickly as possible because it's been such a tumultuous year and a half. But public health social workers are vital to the public health. And again, if you go back to the very history of social work in healthcare, what we started with working with individuals who had tuberculosis, and we put together that intervention program from a public health perspective. So it's in our roots, it's in our professional roots, it must be in our DNA in there somewhere. But public health social workers are vital, again, from looking at that large perspective to protecting the public. Public health social workers probably are most likely employed now in areas along border states in which we're bordering with Mexico, when there's going to be a great deal of immigrants, whether they be documented or undocumented. Those are public health perspectives. Public health in terms of violence. Violence is seen as a threat to public health. Racial hate, racial injustice is seen as threats to public health. So if you go into public health, or if you have any training in public health, a public health social worker looks at more of the macro perspective and not just the individual perspective. Again, what is so great about the social workers and social work professions is we intervene at both an individual and a systems level. We are, I say this in every class I teach, we are like that one profession that is trained from that really, truly holistic perspective, and we can bring all of that together, and we have to. If we get so entrenched into just one area, so just delivering the individual therapy, I'm an LCSW, I have a private practice, and I'm doing that. And we don't actually incorporate these other levels, whether it be through our professional organization from a legislative standpoint or a policy standpoint, building community relations. We're not going to really impact and serve our clients in the way we would want to do that. This separates us from those who get like a LPC or just a counseling degree, and then that's what they focus on is simply counseling. We are so much more of a holistic perspective in bringing all that together. So I encourage students, even if you're going strictly mental health, that you don't ignore the health aspects of it and the psychosocial aspects of it and the community aspects of it, and that you help to bring all of that together for the clients. So again, as health social workers, we have healthcare specifically responsibilities, but we have a variety of roles in the settings, and we collaborate with a variety of healthcare professionals. So if we're not providing direct practice, we're maybe doing collaboration, we're doing administration, we're looking at how the systems work to support the individuals and how the individuals need to work within those systems, and trying to fit all that together. It's like putting a big old puzzle together. That's what I saw it as every day, is trying to put this big old puzzle together for the individuals that we're serving, which happens to be the patients who are in the hospital, their families who are supporting them, the community services that we use to support them, the other healthcare professionals in there, the medical professionals such as the doctors and the nurses and the therapists, administrative support staff. We are truly that hub that's right there that tries to pull all of that together for everyone. And in that, it's, clients aren't presenting to a healthcare system specifically for social work services. So we're seen as an ancillary type of service. But they bring those needs with them, and so we're a vital service. And because they're coming with some medical needs, we have to keep up with some knowledge relating biological aspects, the biophysical care model, medical issues, medical terminology, understanding how to read labs and look at labs, understanding the medical medications, just like we're taught to understand the psychotropic medications. We have to have that medical knowledge. So we need to be finding constant training. We need to be learning how to read charts. We need to be engaging with other professionals. I love finding physicians that like to teach. I was so fortunate to work with a neurologist who is just an amazing teacher, and he would sit during our clinical staffings and present and really explain things and just get on the board and teach. So we need to make sure that we have those opportunities so that we can have the medical knowledge that we need to be able to help the patients and their families. And again, this goes back into making sure the patients and the families are understanding what's happening with them and what's being explained to them. If we don't understand it, we can't be sure they're understanding it. So if you're going to be working in healthcare, no matter what level of care, what continuum, it's important for you to seek out opportunities to get some more of the medical knowledge, whether it be through informal means and just asking nurses, explain to me about this, or whether it be through some certificate programs or some online venues, whatever. It's important for you to seek out that education for the population you're working with. And then as we begin to progress, we're going to be looking at, again, vulnerable patients. We're going to be looking at chronic illness. So I'll be providing you with some medical terminology as we go through this course, which can help you as just kind of a foundation if you don't have it at this point in time. So as we move through the next 3 or 4 modules, then I'm going to be able to provide you with some additional medical terminology and resources. But I hope as you're reading for your paper that you're writing, that you might be engaging with some new medical terminology out there, that you're stepping out of your comfort zone and expanding a little bit on that, because that's how we're going to be able to learn more of the medical aspect of it. And then again, we always need to be active members of the healthcare team. Sometimes it takes a little while to gain the respect of those other individuals in that healthcare team, again, because you're seen as that minority, fix everything. The other thing you're going to find out is anybody who don't know what, in a healthcare setting, when they don't know what to do with the patient, they're going to give it to a social worker. So you may find yourself actually helping with areas that maybe you don't necessarily need to help with, but you can also take that opportunity to do some education down the road. So we need to create literature that does inform other professionals and consumers about the role that we have as healthcare social workers. We need to provide team training about the social work activities and roles that we do and how we can enhance the outcomes for these patients. And then we need to show the evidence of the effectiveness. This is one of the biggest areas lacking in healthcare social work, is we do not show effectiveness of social work services. I posted one article that I had published, and it's been, that data is like, well over 15 years, about 15 years old. And it was simply a national survey where I looked at the different roles and responsibilities social workers were engaging in. And what I can tell you up to this point is, because I'm contacted frequently about that article by other researchers, is there's not been another comprehensive look at that, as well as what I did not do and what still has not been done is we've not been able to say if a social worker is providing discharge planning that includes these components with this follow-up level, it reduces healthcare costs this much and increases patients' outcomes this much. We don't have that. We do not have that evidence. And because we don't have that evidence, then we are not paid as we should be paid. We don't always have the respect we should have. We're not always seen as a high-level professional in these settings as we should be. So we really need more research on the actual effectiveness, not just the description of it, but we need to be able to show cause and effect. We're not there, and we have not gotten there, and I've not seen any recent publications that shows that we're working towards that. We have to be visible in parts of health settings by volunteering to be on different committees, different task force. So again, you may be out of your comfort zone, and oh my gosh, who hates meetings anymore, and who hates having to do all that extra stuff? But this actually helps put us in a good, visible situation in these healthcare settings, which with the ultimate goal being able to better impact the outcomes for the patients and the families that we're ultimately serving. And then provide professional support to our colleagues when they face challenging patient situations, such as when a patient dies. I know with COVID and the immense loss of patients that it's taken a tremendous psychological toll, specifically on nurses who've been providing that care and physicians. And so as social workers in those settings, we actually can become formal and informal servers for those people that we're working with and the difficult situations that they have to manage. So that's just a brief overview of roles and responsibilities for social workers across the gamut. Again, I think that if you're in healthcare, no matter what aspect of healthcare, it's the ultimate social work job. You are touching on every level that we could potentially touch on if we're working in some form aspect of healthcare. So, hope this was interesting for you, and I hope you have a good Module 2 and that the semester is progressing well for you.